I'm proud to introduce you to Proteus Digital Health's first pediatric customer, Children's Health. As the 8th largest pediatric healthcare provider in the nation and the leading pediatric healthcare system in North Texas, Children's Health provides a full spectrum of healthcare services. The health system is consistently named one of the nation's top pediatric providers by U.S. News and World Report and is annually recognized for prestigious quality, IT, and innovation awards. As our first pediatric customer, the Proteus team discovered firsthand why Children's Health is so celebrated. Sarah Sullivan is the clinical manager of the solid organ transplant department within Children's Health and serves as the clinical operations lead for the launch of Proteus Discover. I did the math. It was 35 business days that you all implemented Proteus Discover. That is a feat in of itself and something very impressive, and all under your leadership and Dr. Desai's. I'm curious to hear from your perspective what the experience was implementing Proteus Discover here in the department.
Having been on several projects before, this large project went really smoothly, and I think it's in large part to Proteus and the investment that they were saying pediatrics is important to us, and we're going to show up and we're going to be there and we're going to help y'all. Yep. And here we are. Is there a particular patient, a story of kind of the early use of Discover? We enrolled a school-age child who had had a liver transplant in the program, and his mom, every time she sees me, she will stop me, and if I'm in the hallway, if I'm walking through clinic, she may pop her head out of the room, but she will stop me and say, you know, Sarah, this has really helped. Thank you so much. Just if, you know, you're going out to talking to your peers in the health industry around Proteus, do you have any advice for them on the use of Discover? I would just say it's exciting, it's innovative, it's a new approach. Be open-minded to learning about it and seeing if you can find a way for it to fit in your patient population, because I do think there's real benefit to patients and providers being able to collaborate from the hospital setting to the home setting.
Sarah works with a multidisciplinary team in the solid organ transplant department. One of her colleagues is clinical psychologist Dr. Kelly Triplett. Now that Discover has been introduced to the clinic here, can you explain a little bit about how that changes the way you interact with patients and medication adherence?
Discover has given us such a greater depth, I guess, of data to look at in terms of medication adherence. So we're able to look at things like patterns in medication adherence, timing of when patients are taking their medications, which with this population is so important, as I mentioned, that there are some medications that are very time sensitive, and we just didn't really have great ways to measure that before Discover, where we can see it all laid out and see these patterns, see hey, so you're doing great during the week, but then you're not taking your meds on the weekend.
So I've been hearing about a bear floating around the clinic. Can you tell me a little more about it?
Yes, so our lovely child life specialist, Kinsey, created this little bear.
Oh my goodness.
And our first patient to enroll in Discover named this bear Chelsea. And she wears her patch, and we're able to then show even our teenagers, say, hey, this is what the patch is gonna look like that you're gonna be wearing. So far, they've been very receptive to it, and I do think our little bear has helped.
And I know you mentioned your focus here is in the solid organ transplant clinic, but as you think about your peers who are working in other clinics, do you foresee potential use of Discover in other patient populations here at Children's Health?
Oh, for sure. I mean, adherence is a hot topic in transplant because we know, as I said, these are lifelong medications, they're time sensitive, we have to protect that transplanted organ, but there are many other populations that struggle with adherence. We have many other populations that just have complex regimens. Diabetes or endocrinology would be one where I could see this would be super helpful, even maybe in some of our oncology patients.
Those of us who spend time at Children's Health understand how special this department is and how much Sarah, Dr. Triplett, and their colleagues give of themselves to care for these medically fragile children. We salute them and are proud to be their partners.